Hey everyone, and welcome back to the channel. Today, we're diving deep into a topic that affects every single one of us, whether directly or indirectly: mental health in the United States. It's a conversation that's been happening more openly, which is fantastic, but we need to move beyond just talking and start looking at real, tangible solutions. Let's unmask some truths together. First, let's get a clear picture of the landscape. Did you know that nearly 1 in 5 U.S. adults live with a mental illness? That's over 50 million people, and for young people, the numbers are even more concerning. The pandemic really put a spotlight on this, but these challenges have been brewing for a long time. The reasons are complex. We're talking about a mix of economic pressures, social isolation amplified by social media, and a healthcare system that has historically separated mental from physical health, creating huge barriers to care. Think about it. If you break your arm, you go to the emergency room, no questions asked. But if you're having a panic attack or struggling with deep depression, where do you go? For many, the answer is nowhere. The cost can be astronomical. Finding a provider who takes your insurance can feel like searching for a needle in a haystack, and the stigma, though fading, is still very real. It can make asking for help feel like a personal failure, when in reality, it's a sign of incredible strength. This system isn't just broken. It was never really built to handle the scale of the need. So, how do we fix this? It's a huge question, but the good news is we have a roadmap. The solutions aren't a mystery, they just require commitment and collective action. Let's break it down into 3 key areas: access, integration, and prevention. First, let's talk about access. We need to make getting mental health care as easy as getting care for a common cold. This starts with policy. We need stronger enforcement of mental health parity laws, which say that insurance has to cover mental health the same way it covers physical health. No more ghost networks where a list of in-network therapists are actually not accepting new patients. Technology is a huge part of this solution, too. Telehealth has been a game changer, breaking down geographic barriers. Imagine being able to connect with a therapist from the comfort of your home, on your own schedule. We need to expand and properly fund these services to make them a permanent, accessible option for everyone, especially in rural and underserved communities. Next up is integration. This is a big one. Our minds and bodies are not separate. Your mental state affects your physical health, and vice versa. So why is our healthcare system set up as if they're on different planets? The solution is integrated care. This means putting mental health professionals in primary care offices, in schools, and in community centers. Imagine going for your annual physical and also having a quick, routine mental health check-in. This normalizes the conversation and catches potential issues early, before they become a crisis. It's about treating the whole person, not just a collection of symptoms. This approach has been proven to improve outcomes and, in the long run, even lower overall healthcare costs. And that brings us to our third, and perhaps most important, pillar: prevention and education. We can't just be reactive. We have to be proactive. This starts with our kids. We need comprehensive mental health education in schools starting from a young age. Teaching children to understand and name their emotions, develop healthy coping skills, and recognize when they or a friend might need help is just as fundamental as teaching them math or history. It builds a foundation of emotional resilience that can last a lifetime. This also involves creating communities and workplaces that genuinely prioritize well-being, that encourage open conversations, and that provide resources without judgment. It's about building a culture where taking a mental health day is seen as responsible, not lazy. Now, you might be thinking, this all sounds great, but what can I actually do? This is where the real power lies. Change doesn't just come from the top down, it comes from the ground up. Start by having these conversations with your friends and family. Check in on people. Share your own experiences if you feel comfortable. Your vulnerability can give someone else the courage to seek help. You can also support organizations that are on the ground doing this work, fighting for better policies and providing direct services. And most importantly, advocate. Contact your local representatives. Ask them what they're doing to improve mental health care in your community. Let them know this is an issue you care about, an issue that gets votes. The path forward is clear. We need to tear down the barriers to access, integrate mental and physical health, and build a culture of prevention and education. This isn't a partisan issue, it's a human issue. By working together, we can transform our approach from a system of crisis management to one of genuine well-being. We can build a future where everyone has the support they need to not just survive, but to thrive. Thank you so much for watching and for being part of this crucial conversation. If you found this video helpful or thought-provoking, please give it a thumbs up and share it with someone who might need to hear it. And don't forget to subscribe and hit that notification bell so you don't miss our future discussions. Let's keep talking, let's keep advocating, and let's keep building a healthier future together. See you in the next one.